to be here this morning to give you a snapshot of multiple myeloma. Multiple myeloma is a cancer of the blood. It is not a new cancer. It is the second most common of our blood cancers, second to a cancer called Hodgkin's lymphoma. As I said, it's not new. It's been around since the 1850s, and it was actually found in Egypt and actually studied in Europe many, many years ago. So why are we talking about multiple myeloma this morning at Mount Zion? Let me give you two reasons. The first is that it is a cancer that has stages. So very frequently patients present with symptoms, and I'm going to share those with you this morning. But often patients present who don't have symptoms, and this is a routine finding sometimes on just your exams that you have with your physicians. So what is multiple myeloma? And the second most common reason that I think you need to know about it is that this is a cancer that is significantly increasing in African Americans. So multiple myeloma is the cancer of a cell of plasma cells. Plasma cells are part of the white blood cells, and they produce components in the immune systems that actually stimulate in fighting of infection. So they play a very important role. Now in cancer, we know that cells grow rapidly, uncontrollably. So whatever function that particular cell has, it becomes cancerous, losing its ability to form normal functions. So in this case, the myeloma plasma cell produces things to fight infections, but they're just not have the ability to do so. And because they do this abnormally, they result in give harm to the cancer patient who has multiple myeloma. In addition to you not being able to fight off infections, because these cells are located in the lower part of the back, the bone marrow, and in the chest, they crowd out other cells. Other blood cells are important. For example, we know that if you don't have your red blood cells, you can get anemia, so you can have fatigue. Also, because they're in a very narrow space, they injure the bone. So our bone in our body is balanced by development and loss. So what these abnormal cancer cells do is they stimulate the ones that destroy the bones. So your bones become very fragile and you can have fractures. And when you have bone loss, you have an excess amount of calcium. And calcium can cause confusion. It can cause ultimately harm to the kidneys and can result in kidney failure. And also the kidney disease can progress quite significantly. So what are the risk factors for developing multiple myeloma? One is that it occurs most commonly in men. Secondly, it generally is a disease of older individuals, the median age of 69. However, we're finding that in African Americans, we're seeing it at an early age onset. We also have some information and data to suggest that in West Africa, in Ghana, that not only are we seeing it early, but we see it in all age ranges within the adult time frame. So that's very important. The third risk factor is actually being black. If you take 100,000 patients and you happen to be a white male, then the incidence is around 7 per 100,000. If you're black, it doubles to 14. If you are a white woman, we're talking about 4 out of 100,000, and if you're African American, it goes up to 10. So we think that there may be a genetic component to that. So if you have family members that have had multiple myeloma, that's an important bit of information to share with your physician. The other risk factor that I want to share with you is that multiple myeloma doesn't come overnight. There is something called monoclonal gammopathy of undetermined significance. I'm not going to test you on that. We refer to it as MGUS, M-G-U-S, and that is extremely important because all patients who develop multiple myeloma have MGUS, but not all MGUS will progress to multiple myeloma. So this is a very important area of research for us. So what are the symptoms that you might look for? Acute pain in the back. You may have nausea and vomiting from the excess calcium that you may have. You may have increased thirst. You might have some problems with bleeding and, of course, fatigue, and there are other risk factors. So I want to leave you with a couple of things to think about. First of all, because we have a lot of data, we don't have anything to suggest that if you are African American, that your outcome is going to be worse. In fact, we have some data to suggest that African Americans are responding better than other populations. However, we do know that within our communities we have other chronic diseases. We have hypertension, we have lots of cardiovascular disease, including hypertension, diabetes. So that some of the symptoms that I have mentioned to you may be subtle. You may not be able to sort out what is actually occurring. However, if you do have them, please sort them, bring them to your physician. And again, you may not have any symptoms at all, and your physician may take a urine sample and find some abnormalities there, and will go forth with the workup. The other thing I wanted to bring forward to you is that if you have a diagnosis of multiple myeloma, we've made quite a significant amount of progress and advances. We have agents now that are not just our regular chemotherapy, but we have things that can stimulate the immune system, immunotherapy. We have targeted therapy that will go right to the cancerous cells and not harm as much your normal cells. But the last thing I'd like to share with you is that if you have family members or friends, or you develop multiple myeloma, or you have been diagnosed with having the benign MGUS, and you're asked to participate in a clinical trial, please consider that. We won't know how to answer the questions about the early onset disease of multiple myeloma amongst our community if we don't have participation in the trials. We like to have representation so that our data, our research will be applicable to everyone. And on that, I thank you very much for your attention.